Hello everyone, my name is Zefr Chao and I'm a fourth year medical student at UNM, and today I will be presenting a case that I worked on with a fellow medical student, Sabah Osmani, along with Dr. Deepti Rao, titled Don't You Dare Forget About Rare Lemierre. First, an introduction. Lemierre disease is also called jugular venous suppurative thrombophlebitis, and it usually affects young patients and presents as an infectious thrombotic embolus in the internal jugular vein. The source of infection is usually in the oropharynx, from primary infections like pharyngitis or tonsillar infection. Another rare cause may also be dental abscesses. It is a very uncommon disease, only affecting approximately 3 million people per year, but awareness is extremely important because if left untreated, it can be fatal. Our case is a 20-year-old female with no prior past medical history who presented to a rural hospital on the Navajo reservation with shortness of breath and right-sided throat pain. She met sepsis criteria and had a chest x-ray that showed bilateral lung opacifications with blood cultures positive for Streptococcus constellatus. She was started on broad-spectrum antibiotics and transferred to a larger center for further workup of suspected acute infective endocarditis. On physical exam, she appeared ill and unwell. She was tachycardic and hypotensive, but sat well on room air. Coarse breath sounds heard diffusely throughout her bilateral lung fields were also auscultated. Labs were significant for leukocytosis, anemia, severe thrombocytopenia, and an elevated BNP. CT with contrast revealed two foci of non-obstructive thrombi in the right inferior jugular vein and pulmonary nodules indicative of septic emboli in her lungs. The patient's presentation, abnormal lab, and physical exam findings in the setting of her recent dental procedure were suggestive of Lemierre syndrome. She was started on apixaban and placed on IV ceftriaxone before later being discharged with a peripherally inserted central catheter for a 3-month-long continued treatment. As this case illustrates, Lemierre syndrome is caused by bacterial invasion through the carotid sheath in the parapharyngeal space, resulting in infectious internal jugular vein thrombosis. It commonly affects previously healthy patients in their 20s and 30s, although most commonly it manifests as Fusobacterium necrophorum. Our case was due to the introduction of normal oral flora into the blood after a dental procedure. Scientific advancements in the past few decades have significantly improved mortality rates to less than 17%. More recently, there has been an observable rise in incidence rates, possibly due to more conservative use of antibiotics to treat pharyngitis and tonsillitis. Most patients make a full recovery with proper diagnosis and treatment, and practitioners should be aware of Lemierre syndrome in young patients who present with throat pain, sepsis, and suspicious findings on imaging.